Hello and welcome to Workers Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. So let's get started. Welcome back to Season 2 Workers Comp Unwrapped. With me today is Aisha, who has 15 years of experience in the workers' comp industry.
It's great to be here.
Today, we're talking about a practical guide for providers to understand what is expected of injured workers during the claims process
This is such an important topic.
and what you can do to ensure things run smoothly.
Because maximizing revenue often comes down to understanding the other side of the process.
Okay, let's unpack this.
Okay.
I know we always say how important it is for injured workers to report their injuries promptly.
Right.
But why does it matter so much?
Right.
What are the real consequences of delaying that report?
Imagine a car accident.
Okay.
The longer you wait to report it,
Eh.
the more suspicious it seems, right?
Right.
The same logic applies to workers' comp.
Okay.
If a worker waits weeks or even months to report an injury,
Wow.
insurers might question whether it truly happened at work
Yeah.
or if it's as severe as the worker claims.
I see.
That skepticism can lead to investigations,
Oh.
delays in processing the claim,
Yeah.
and even denials.
That makes sense.
Yeah.
It's all about establishing a clear timeline and credibility from the start.
Right.
So for providers,
Yeah.
how can they help ensure things stay on track in those crucial early stages?
You're in a powerful position here.
Okay.
During that initial visit,
Mm-hmm.
simply asking,
Yeah.
have you reported this to your employer,
Oh, wait.
can be a game changer.
That's a good point.
If the answer is no,
Uh-huh.
gently explain the importance of reporting promptly
Yeah.
and reassure them about their rights as an injured worker.
Good point.
You can even offer to help them navigate the reporting process
Why?
if they're unsure how to go about it.
That's a great point.
Yeah.
It's not just about treating the injury.
Mm.
It's about being a partner in the entire process.
Right.
Now, once the injury is reported,
Yes.
we have the infamous DWC-1 form.
Okay.
I know it can sound intimidating, but can you break it down for us?
Sure.
Especially the parts that directly involve the injured worker.
The DWC-1 is basically the official document
Okay.
that kicks off the entire workers' comp claim.
I see.
It's divided into sections.
Uh-huh.
The employer fills out their portion describing the incident,
Okay.
and the injured worker has their own section
Right.
where they provide details about the injury itself and how it happened.
Okay.
This is their chance to tell their side of the story.
Yeah.
It's crucial that they're accurate and thorough
Mm-hmm.
because inconsistencies can lead to delays and disputes down the line.
So it's not just paperwork.
Right.
It's their opportunity to officially document the injury from their perspective.
Exactly.
It's easy to see how mistakes here can snowball into bigger issues later.
Absolutely.
Now, once the claim is underway,
Yeah.
let's talk about medical care.
Okay.
I know workers' comp often has its own network of approved providers.
Right.
What happens if an injured worker decides to go outside of that network?
Yep.
Are they just stuck with the bill?
It's not quite that simple.
Okay.
Workers' comp cases usually require treatment within a specific medical provider network or MPN.
Got it.
There are valid reasons for this,
Okay.
like ensuring quality care and managing costs. If a worker decides to go outside the MPN
Right.
without proper authorization,
Yeah.
there are consequences.
Right.
They might end up being responsible for the full cost of treatment,
I see.
which can be financially devastating.
Yeah.
However, there are exceptions,
Okay.
like emergencies
Right.
or situations where a particular specialist isn't available within the MPN.
Uh-huh.
It's important to help patients understand the rules
Right.
and how to navigate the system effectively.
So it's not about restricting their choices.
Right.
It's about helping them make informed decisions that protect their health and their finances.
Exactly.
Speaking of making informed decisions,
Yes.
one thing I've always wondered about is attending appointments. Is it really that big of a deal
Well,
if a worker misses an appointment or two?
it can be.
Okay.
Life happens, right? While it's understandable that things come up,
Yeah,
missed appointments can be a red flag in the workers' comp world.
I see.
It's not just about being polite. It's
Yes.
about demonstrating a commitment to recovery.
Right.
Insurers might interpret missed appointments as a lack of seriousness about the injury, potentially jeopardizing benefits.
Right.
Imagine if you're building a house
Okay.
and suddenly the contractor stops showing up.
Yeah.
You'd start to question their commitment to the project, right?
Yeah, I see your point. It's about building trust and showing that they're actively participating in their own recovery.
Right.
Providers must be really good at juggling schedules, and making things work for their patients.
Definitely.
What are some strategies they can use to minimize those missed appointments?
One thing I found helpful is offering flexible scheduling options. If a worker has transportation issues or a demanding work schedule,
Right.
try to accommodate their needs whenever possible.
I see.
And of course, reminders are crucial.
Good point.
Utilize text messages, emails, phone calls,
Mm-hmm.
whatever works best for the patient.
Right.
It's a small effort that can make a big difference in keeping those appointments on track.
That makes a lot of sense.
Yeah.
Now let's talk about treatment plans.
Okay.
It seems obvious that workers should follow their doctor's orders.
Right.
But what are some common pitfalls that can derail their progress?
One common mistake is pushing themselves too hard,
Okay.
thinking it'll speed up recovery. Imagine you're recovering from a sprained ankle.
Okay.
If you ignore your doctor's advice
Yeah.
and start running too soon,
Right.
you risk re-injury and prolonging the healing process.
Okay.
The same principle applies to any injury.
I see.
It's crucial for providers to explain why following the treatment plan is essential, not just giving orders.
That's a great analogy.
Thanks.
It's about understanding the why behind the treatment, not just blindly following instructions.
Exactly.
Another pitfall is the opposite,
Okay.
not doing enough.
Right.
Sometimes workers might skip prescribed exercises or therapies
Yeah.
if they're feeling better, or get discouraged if progress is slow.
I see.
This could lead to plateaus in their recovery or even setbacks.
Right.
It's important to encourage them to stay engaged
Yes.
and to communicate openly about any challenges they're facing.
Absolutely.
So it's about finding that balance between pushing too hard and not doing enough.
Right.
It sounds like a constant conversation between the provider and the patient.
It is.
Now, one thing we haven't touched on yet is keeping everyone informed.
Okay.
How important is communication between the worker,
Yeah.
the provider, the employer,
Right.
and the insurer?
Transparency is absolutely essential.
Okay.
Any significant changes in the worker's condition, whether positive or negative, need to be communicated to everyone involved promptly.
I see.
This allows for adjustments to the treatment plan, ensures everyone is on the same page regarding the worker's progress,
Okay.
and prevents surprises or disputes down the line.
Good point.
Think of it like a relay race.
Okay.
If the baton isn't passed smoothly,
Yeah.
the whole team suffers.
That's a great way to put it.
Thanks.
It's a shared responsibility to keep the information flowing.
Absolutely.
Now let's talk about returning to work.
Okay.
It can be a sensitive topic for injured workers.
It can.
How can providers help them navigate this process and ensure a smooth transition?
This is where those strong communication skills come in again.
Okay.
Providers should clearly explain the return to work process, addressing any fears or concerns the worker might have.
Right.
They should also collaborate with the employer
Yeah.
to determine appropriate accommodations or modifications, ensuring a safe and sustainable return to work.
It's important to remember that returning to work isn't a failure.
Good point.
It's a sign of progress.
So it's about framing it positively and focusing on their abilities, not their limitations.
Exactly.
Now, I know we've painted a pretty ideal picture so far,
Yeah.
but let's be real for a minute.
Okay.
What are some of the common challenges workers face
Sure.
when trying to fulfill these responsibilities?
One of the biggest hurdles is fear.
Okay.
Workers might be afraid of losing their job if they report an injury,
Right.
especially in industries where job security is precarious. Others might worry about being perceived as weak or unreliable.
I see.
These fears are understandable,
Yeah.
and it's important to address them with empathy and reassurance.
That's an important point.
Yeah.
It's not just about understanding the rules.
Right.
It's about navigating the emotional and social complexities of the situation.
Exactly.
And then there's the issue of financial stress.
Ah,
Being out of work due to an injury
yes.
can create a huge financial burden. It can.
Workers might be tempted to rush back to work
Yeah.
before they're fully recovered,
Right.
putting their health at risk.
Yeah.
It's crucial to help them understand the potential long-term consequences of such decisions.
Absolutely.
So it's about weighing the short-term gain against the potential long-term costs.
Exactly.
Now, I imagine some workers might feel overwhelmed by the entire process.
Sure.
It's a lot to take in,
It is.
especially when they're already dealing with pain and uncertainty.
Right.
How can providers offer support beyond just medical care?
Sometimes the simplest gestures can make the biggest impact. taking the time to listen to their concerns, offering words of encouragement, and helping them connect with resources like support groups or financial assistance programs can go a long way in easing their burden and empowering them to navigate the process successfully.
That's a great reminder that providers can be so much more than just doctors in these situations.
They can be.
It's about being a partner, an advocate, and a source of support throughout the entire journey.
Exactly.
Well, this has been incredibly insightful. I'm sure our listeners are feeling much more equipped to understand the complexities of injured worker responsibilities.
I hope so.
And the vital role they play in maximizing revenue.
Absolutely. We've talked about the ideal scenario, but let's get real.
Okay.
Sometimes things go wrong.
Yeah.
And workers make mistakes that can negatively impact their claims. And by extension, your practice's revenue.
Okay, let's dive into those common pitfalls.
Okay.
What are some things you've seen that can really trip workers up?
One of the biggest, and we touched on this earlier, is failing to report the injury promptly.
Right.
They might be hoping it'll just go away on its own.
Okay.
Or they're worried about repercussions from their employer.
Yeah.
Unfortunately, this can raise red flags with the insurer.
I see.
Leading to doubts about the validity of the claim and potential denials.
That makes sense from the insurer's perspective.
Right.
It's like, if it was really that bad, why didn't you report it right away?
Exactly.
Yeah.
And it can lead to a lot of unnecessary back and forth, delaying treatment, and ultimately hurting everyone involved, including you as the provider.
So what can providers do to prevent this from happening?
Early intervention is key.
Okay.
During that first visit, make it a point to ask if they've reported the injury.
Right.
If not, gently explain the importance of prompt reporting and offer assistance. Sometimes simply providing a sample letter they can use to notify their employer can make a world of difference.
That's a great tip.
Yeah.
It's about removing those barriers and making it as easy as possible for them to do the right thing.
Right.
What about the DWC-1 form?
Okay.
We talked about how crucial it is.
Yes.
But what are some common errors workers make that can delay things?
One common mistake is incomplete information. They might leave out important details about the injury, how it happened, or their medical history.
I see.
This can lead to requests for clarification, slowing down the entire process.
Okay.
Another mistake is inconsistency.
Okay.
If their description of the injury on the DWC-1 differs from what they told their doctor or employer, it raises doubts and triggers investigations.
So it's not just about filling out the form.
Right.
It's about accuracy and consistency across all interactions.
Precisely.
Providers can play a detective role here.
Yes, they can.
When reviewing their medical history, ask specific questions about the incident to ensure it aligns with what's on the DWC-1.
Right.
If you spot any discrepancies, gently guide them to correct the information.
Exactly.
It's about being that second set of eyes and catching those potential issues before they become bigger problems.
Absolutely.
Now let's talk about medical care. I know workers' comp often has its own set of rules and networks.
Right.
Can you explain why staying within the designated network is so important?
Sure.
What are the risks of going rogue?
Workers' comp systems usually have medical provider networks, or MPNs.
Got it.
To ensure quality care and manage costs.
Okay.
Think of it like a curated list of trusted providers.
I see.
Going outside this network without proper authorization can be costly.
Okay.
The insurer might refuse to cover the treatment, leaving the worker responsible for the entire bill.
That's a financial nightmare I'm sure no one wants to face.
No, they don't.
And it can create friction between the worker, the insurer, and even the provider.
Exactly.
It's crucial to help patients understand the rules and navigate the MPN effectively.
Yes.
If they have a specific doctor they want to see, guide them through the process of getting that doctor authorized within the network.
Absolutely.
It's about being that navigator, helping them chart the best course within the system.
Exactly.
Now let's shift gears to a topic that can be a bit sensitive.
Okay.
Missed appointments.
Right.
It's understandable that things come up.
They do.
But why are missed appointments such a big deal in workers' comp?
Imagine you're an insurer.
Okay.
And you see a pattern of missed appointments. It raises questions.
Okay.
Are they really that injured?
Right.
Are they committed to their recovery?
I see.
These doubts can impact benefit eligibility and even lead to suspicions of fraud.
I can see how it creates that impression of not taking the process seriously.
Exactly.
Yeah.
And for you, the provider, missed appointments mean lost revenue and disruptions to your schedule. It's a lose-lose situation.
So what can providers do to minimize those pesky no-shows?
Be proactive.
Okay.
Implement a system for appointment reminders.
Right.
Text messages are great for that, but also confirm preferences.
Okay.
Some people still prefer phone call.
Yeah, that's true.
Offer flexible scheduling options.
All right.
If a worker has transportation issues or childcare constraints, try to work around their schedule.
It's about showing that you're flexible and understanding of their situation.
Exactly.
Now, what about treatment plans?
Okay.
What are some mistakes workers make that can delay their recovery and potentially impact your reimbursements as a provider?
One common pitfall is not understanding the rationale behind the treatment plan. They might think, why am I doing these exercises? They hurt. Or this medication isn't working.
I see.
It's crucial to explain the why behind each element, connecting it to their specific injury and goals.
It's about making them active participants in their recovery.
Exactly.
Not just passive recipients of treatment.
Right.
Another mistake is not reporting changes in their condition promptly.
Yeah, that's a big one.
Maybe they're feeling better and decide to skip a few therapy sessions. Or maybe they're experiencing new symptoms. Whatever the change.
Yeah.
It's crucial to communicate openly and immediately.
Absolutely.
Delays in reporting can complicate the claim and hinder progress.
It can.
So transparency is key.
It is.
It's about keeping that open line of communication with their provider, employer, and the insurer.
Exactly.
Now let's talk about a topic that can be a bit uncomfortable, but needs to be addressed.
Sure.
Fraud.
Right.
What do workers need to know about this?
Well,
and how can providers help prevent it?
Workers' compensation fraud is a serious issue with serious consequences.
Right.
It's about intentionally deceiving the system for personal gain.
I see.
Whether it's exaggerating an injury, faking an injury altogether, or continuing to collect benefits while working.
It sounds like it's not just about bending the rules a little.
Right.
It's about deliberate dishonesty.
Exactly. And while it's a small percentage of cases, fraud hurts everyone.
Right.
It drives up costs, erodes trust, and makes it harder for those with legitimate claims to receive the benefits they deserve.
So how can providers play a role in preventing fraud?
Be vigilant. Look for inconsistencies in the worker's story or behavior. Document everything meticulously.
Right.
If you suspect fraud, report it to the appropriate authorities. It's not about being suspicious of everyone. It's about protecting the integrity of the system.
It's about being that ethical gatekeeper.
Exactly.
Now let's shift gears to some more positive strategies. What are some practical tips providers can use to help workers navigate the system successfully and in turn ensure smoother claims processing and reimbursements for your practice?
Communication is key. Explain things clearly and concisely, using plain language they can understand.
I see.
Don't overwhelm them with jargon or technicalities. Make sure they understand their rights and responsibilities, the different stages of the claims process, and the importance of following the treatment plan.
It's about empowering them with knowledge.
Exactly.
And remember, communication is a two-way street.
It is.
Encourage them to ask questions, voice their concerns, and actively participate in their care.
It's about building that partnership, that trust, and that open dialogue.
Absolutely.
I imagine technology can play a huge role.
It can.
In streamlining communication and making things easier for everyone.
Definitely.
What are some tech tools that providers should be utilizing?
Oh, absolutely.
Automated
appointment reminders via text or email are a game changer. They're simple to implement and highly effective in reducing no-shows.
That's a good point.
Patient portals are another fantastic tool. They allow workers to access their medical records, view test results, communicate with you directly.
And even schedule appointments online.
I love that. It puts more control in their hands, which can make them feel more empowered and engaged in the process.
Exactly.
What other tech tools are out there that you've found helpful?
We're in a golden age of health tech.
That's true.
There are telehealth platforms that enable virtual appointments, which can be particularly helpful for workers facing transportation challenges or living in rural areas. Then there are mobile apps that help them track their progress, manage their medications, and stay on top of their treatment plan.
I see.
Even wearable devices, like fitness trackers, can provide valuable data for recovery monitoring.
It's incredible how much technology has transformed healthcare.
It is.
Even in the workers' comp world.
Absolutely.
And for providers, embracing these tools isn't just about staying ahead of the curve. It's about improving patient care, increasing efficiency, and ultimately maximizing revenue.
Exactly.
Now let's talk about education.
Okay.
How can providers go beyond simply treating the injury and educate their patients about the workers' comp process?
Think of it like providing them with a roadmap. Create a simple, easy-to-understand guide that outlines the key steps, their rights and responsibilities, and available resources. This can be a physical handout or a digital resource they can access online.
That's such a valuable resource.
It is.
It takes away some of the mystery and fear surrounding the process.
Exactly.
And don't just hand it to them and move on.
Right.
Take the time to review the key points, answer their questions, and address any concerns they might have.
Yes.
The more informed they are, the better equipped they'll be to navigate the system effectively.
Absolutely.
It's about empowering them with knowledge and building their confidence. Now, we've talked a lot about the workers' responsibilities. But let's circle back to the provider's role as an advocate. What does that look like in practice?
Advocacy can take many forms. Sometimes it's about being a strong communicator, keeping the employer and insurer informed about the worker's progress and any challenges they're facing. Other times, it's about going to bat for your patient if you believe their rights are being violated or they're not receiving the care they deserve.
So it's about being their voice.
Exactly.
Especially when they might feel powerless or unheard.
Right.
And it's not just about being vocal. It's about being informed.
It is.
Stay up to date on the latest laws, regulations, and best practices in workers' comp.
Absolutely.
The more knowledgeable you are, the more effectively you can advocate for your patients.
Exactly.
Now, I know we've covered a lot of ground here, but one topic we haven't touched on yet is documentation. How important is meticulous record keeping in the workers' comp world?
Oh, it's crucial.
Okay.
And how can it impact a provider's bottom line? Documentation is absolutely crucial. Think of it like building a solid case for your patient and for your practice. Your notes should be detailed, accurate, and legible.
Got it.
Document every interaction with the patient, the employer, and the insurer. Include all relevant objective findings, test results, and treatment recommendations.
So it's not just about jotting down a few notes.
Right.
It's about painting a clear and comprehensive picture
Exactly.
of the patient's journey.
Precisely.
Good documentation serves multiple purposes.
It does.
It supports the claim, prevents disputes, provides valuable data for tracking progress,
Right.
and protects you from liability. It's an investment in your patient's well-being
Yes.
and your practice's financial health.
It is.
It's like they say,
Yeah.
if it wasn't documented, it didn't happen.
Exactly.
Now, beyond all the practical tips and strategies we've discussed, what's the most important thing for providers to remember
Sure.
when working with injured workers?
Empathy.
Oh?
Remember that they're going through a lot.
Right.
They're dealing with pain, disability,
Yeah.
financial stress,
Right.
and uncertainty about the future.
I see.
Treat them with kindness, respect,
Right.
and understanding.
It's about seeing them as human being cases or claims.
Right.
That human connection can make all the difference
It can.
in their recovery
Yeah.
and their overall experience with the workers' comp system.
Absolutely.
Well, this has been incredibly insightful.
Thank you.
We've covered so much ground,
We have.
from common mistakes to practical tips and the importance of empathy. I'm sure our listeners are feeling much more prepared
I hope so.
to support their patients
Yeah.
and navigate the complexities of the workers' comp world. We've talked about the importance of communication technology, education, and empathy in supporting injured workers and ensuring smoother claims processing.
Right.
But sometimes real-life stories are the best teachers.
Absolutely.
Case studies can really bring these concepts to life.
Yeah.
And highlight the impact of provider involvement.
They can.
Okay, so let's dive into some real-world examples.
Okay.
Do you have any cases that stand out as particularly illustrative of the points we've been discussing?
I do.
Okay.
There's one case that really highlights the importance of early intervention and building trust.
Okay.
I was treating a young man who had just started a new job in construction.
Okay.
He injured his hand while operating some heavy machinery.
Oh, wow. A hand injury in construction.
Yeah.
That's a major concern.
Exactly.
Yeah.
It could have long-term implications for his career.
Right.
When he came to see me, he was visibly shaken.
He was worried about losing his job. He didn't understand the workers' comp process.
Yeah.
And he was anxious about the future.
It sounds like he was facing a lot of those common fears and uncertainties we talked about earlier.
He was.
Yeah.
So I knew my first priority was to create a safe space for him to open up.
Okay.
I spent extra time explaining the workers' comp process in plain language.
Right.
Assuring him of his rights and addressing his concerns about job security.
It's about meeting them where they are emotionally and providing that reassurance.
Exactly.
Yeah.
And then I asked the crucial question.
Okay.
Have you reported this to your employer?
Right.
He hesitated, admitting he was afraid of being seen as a troublemaker.
I see.
I explained the importance of prompt reporting.
Yeah.
And even offered to help him draft a letter to his employer.
That's going above and beyond.
Sometimes those small gestures can make a world of difference.
That's true.
He was so relieved to have that support.
Good.
He reported the injury that same day.
And things move forward smoothly from there.
That's encouraging to hear.
Yeah.
It sounds like that early intervention and guidance really set the stage for a positive outcome.
It did.
Yeah.
He was diligent about his treatment.
Okay.
Followed all the recommendations, and kept me informed about his progress.
Good.
And because the claim was filed promptly,
Right.
and there were no red flags, everything went smoothly with the insurer.
That's a great example of how a provider's actions in those early stages can have a ripple effect throughout the entire process.
Absolutely.
Now let's talk about a case that illustrates the power of advocacy.
Okay.
I had a patient who worked in a warehouse,
Right.
and she injured her back while lifting heavy boxes.
Back injuries are so common, especially in physically demanding jobs.
They are.
Initially, we treated her conservatively with pain medication and physical therapy, but her symptoms persisted, and she started experiencing numbness and tingling down her leg. I was concerned it might be more than just a muscle strain.
Those are definitely red flags.
They were.
Yeah.
I ordered an MRI,
Okay.
and it revealed a herniated disc pressing on a nerve.
I see.
I recommended a referral to a spine specialist
Okay.
for further evaluation and possible surgery.
Sounds like a reasonable course of action.
It was,
Yeah.
but the insurance carrier denied the referral,
Oh, wow.
claiming surgery wasn't medically necessary.
That's frustrating.
Yeah.
It sounds like they were trying to cut costs at the expense of her health.
I was furious. I knew she needed specialized care, and I wasn't going to let bureaucratic hurdles stand in the way.
Right.
I gathered all her medical records,
Okay.
wrote a detailed letter to the insurer explaining why the referral was crucial,
Good.
and even contacted her employer to enlist their support.
So you were her champion,
I was.
fighting for her right to receive appropriate care.
Exactly.
And thankfully it worked.
It did.
With pressure from both her doctor and her employer,
Right.
the insurer reversed their decision and approved the referral.
They did.
She had the surgery,
Yes.
made a full recovery,
Uh-huh.
and was able to return to work. That's such a powerful story.
It is.
It shows that providers can and should be strong advocates for their patients,
Absolutely.
even when it means challenging the system.
Advocacy is a crucial part of our role,
Yeah.
especially in a system as complex as workers' comp.
These cases have been so insightful.
Good.
They really highlight the impact providers can have beyond just medical treatment.
They do.
And they demonstrate how understanding the nuances of workers' comp
Right.
and going that extra mile can benefit everyone involved.
Yes.
The worker, the provider, the employer, and even the insurer.
Absolutely.
Well, Aisha, this has been an incredible deep dive into the world of injured worker responsibilities
Thank you.
and the essential role providers play in navigating the workers' comp process.
It's been my pleasure.
Thank you so much for sharing your expertise and insights.
You're welcome.
And for our listeners,
Yeah.
we hope you've gained valuable knowledge and practical tips
I hope so.
that will empower you to support your patients.
Absolutely.
optimize claims processing, and ultimately maximize your revenue.
Exactly.
Remember, knowledge is power.
It is.
And in the workers' comp world,
yeah,
that power translates to better outcomes for everyone.
it does.
Thanks for tuning in to Workers' Comp Unwrapped.
Uh-huh.
Until next time, stay informed, stay engaged, and stay well. Thank you for listening to Workers' Comp Unwrapped. If you found value in today's episode, share it with your fellow medical providers and healthcare specialists. For more information, contact us at lena.klein@medicallienmgt.com or visit our website, medicallienmgt.com.